Hello and welcome everyone. It's great to have you here at the end of day 2 of Rewired, and what an amazing agenda it's been, and well done for sticking till 5 o'clock and coming to join us. We're really grateful that you've joined us at this time of the day. We're really keen. I've got a great panel here for you today to talk about our collective leadership as nurses and midwives in terms of taking forward the digital agenda. It's a year since I attended Rewired last. Wow, what a year it's been. And at that point, it had just been announced that I would be the national CNIO for England, working across X, E and I. Quite a daunting task, and I remember being mobbed at Rewired, and this is a very different experience because I can't be mobbed, we're all virtual. But it was my ambition at that time to unite us as a profession on a shared set of objectives for digitally enabled nurses and midwives to have more digital nursing and midwifery leaders working with me to craft those objectives into a strategy and take them forward to a digital future where technology and data support us to give the very best care to our patients. And I'm really lucky today to have a great panel here with me who are that collective leadership group, or certainly part of it, that I was hoping that we would have. So you're not going to have to listen to me for too long, because these guys are going to share how they are leading their various elements of the professions in digital transformation. I guess it's fair to say that since that Rewired 1 year ago, a lot has happened. We've been through a very challenging period with the COVID pandemic, and we're all tired from the monumental collective effort of responding. I think it's fair to say that our lives have changed forever. None of us have been left untouched by the pandemic. But I guess what's interesting is that there is a positive that's come from this experience, in that we've accelerated the use of digital technologies exponentially, and the use of data. Necessity has forced us to adopt new ways of working. So something that would have taken us as digital nurse leaders, digital midwife leaders, a long time to move along has moved rapidly over the last year. And I, probably like many of you, want to take the opportunity to take the best of this change forward, to reflect and learn together to shape the 8 principles of digitally enabled nursing and midwifery practice that I launched at the Chief Nurses Summit last year. I've been busy since I've been appointed in terms of building team, building capability, and most recently launching a digital maternity assessment that I'm going to take the opportunity to shamelessly plug here. So our digital nursing maturity assessment, our midwives were ahead of us in that game, weren't they, Julie?
Yes.
But we have launched an assessment. I deliberately sent it to chief nurses because I wanted to send that signal that this is everybody's business. It's not for a unique subset of the profession anymore. It's everyone's business. And we've had a great response, 130 so far of about 200 provider organisations. But we want to get to 100% response rate. So if you are a CNIO or a lead digital midwife, and you haven't seen it, go back and ask your chief nurse. And we've also posted the link on Discourse. So digital transformation can't be down to an individual leader. And I'm delighted to have a collective of senior leaders alongside me in this endeavour. I'm delighted to be chairing the session today about how we use our collective leadership voices to strengthen and amplify our contribution to the digital agenda to make sure we get what we need. I have a fantastic panel here today who are going to explain individually how their roles and how they are working to support the profession to be digitally enabled and supporting others to lead, importantly. So our first panellist is Jo Dickson, who will talk about her role as chair of the CNIO network and the steps she's taken to strengthen that community. We're then going to have Tim tell us about his role at the RCNE Health Forum and how that group are working for our collective benefit. Jacqueline Davies will talk about her role at Cerner and the importance of our collective clear-cut voices with suppliers. And finally, Julia will talk to us about the work of DMIRG in bringing midwifery expertise to a national programme and using their voice to influence what happens nationally, which they do splendidly. So individually, I'd say they're all making an amazing impact. Together, wow, what a force for good. It's an amazing panel. And without further ado, I'm going to hand over to Jo to tell us about her leadership of the Digital Health CNIO network. Over to you, Jo.
Thanks, Natasha. Really great to be here with you all today. As Natasha says, you know, what a year we've had, and we've done a lot as a digital health CNIO network in the last year. But I think one of the key parts of what I feel we've done over the last year is collaborate more than ever before. You're right. The last time I probably saw anybody, well, certainly anybody on this call today in person, was at Rewired this time last year. That and the summer school are always two highlights of my year, and so it's really great to be here this afternoon, even if it is virtually, to talk to everybody. As Natasha said, I am the current chair of the Digital Health CNIO network, and I guess my first point about that is that there may actually be people on this call this afternoon who don't know what that is. So if you don't, I would very much recommend that you come along and be part of that network. We're on the Discourse, the Digital Health Discourse platform. So anybody who isn't yet a member and isn't engaging with that community of nurses, midwives and allied health professionals, please come along and join us. As I say, we've built a lot of momentum over the last year, and one of the things that I think's really strengthened is the collaboration, but it's also in part due to the new team at NHSX under Natasha's leadership. What's been great is that we've been able to sort of accelerate, I think, that collaborative working as a professional group over this past year, and I'm really keen that we continue to do that into the future, that we sustain the momentum and that we increase it further. So one of the things that I did want to tell this group about this afternoon is that our plan is to have a complete refresh of our advisory panel later this year. So anybody who is part of the forum already or part of the network already and is considering whether they might want to be a part of an advisory panel, I think it's a really great opportunity, both for you individually, but also for you professionally, in terms of getting involved with that advisory panel. So if anybody is interested in knowing more about being part of the Digital Health Network, the CNIO advisory panel, please get in touch with me and I'd be really happy to talk you through it. The elections are going to be held over the summer, and we're really keen to have as many people as possible become involved with that. We're a really inclusive network, so you don't have to have CNIO as your title, for example. You can be an allied health professional, and you can be at any sort of aspect of your career, whether you're just starting out and aspire to the role of a CNIO, or whether you're working at that level already. We do a lot of good things as part of that network, and I see us as the sort of frontline group of people who are working collectively and collaboratively with Natasha and others within central organisations to really bring that collective professional voice to everything that we're doing from this perspective. So anybody who is interested in knowing more about the network or getting involved with the advisory panels, please get in touch, and I'd be really keen to talk to any of you. Thanks, Natasha.
Thank you very much, Jo. What I'm going to do is move along through each panel member and then save questions for the end. So Tim, you're up next, please. Tell us about what's up in the RCN.
Yeah, hi everyone. Really good to see you, albeit virtually, and thanks Natasha for the introduction, and Jo, your words as well about the network. So I want to tell you a little bit about the Royal College of Nursing eHealth Forum. Again, very similar to what Jo was saying, you might not know much about it, but the forums are the way that the Royal College of Nursing works in terms of setting its policy and what it wants to go and do, the work that it will do as an organisation. So the eHealth Forum has been running for a number of years now. I've actually joined just very recently, just at the end of 2020, being an eHealth Forum committee member. But one of the things that we're doing at the moment is re-establishing what our priorities are. So we're looking specifically at the fundamentals of getting the basics right in digital, leadership development, innovation, shaping information standards, and promoting diversity. And one of the things that we took to RCN Congress last year, and for those who don't know, RCN Congress is where the membership of the RCN gather, where they debate, where they decide on that work that will be done. One of those items last year was around the piece around diversity. And so leading on from that this year, we are putting together a proposal that we're taking to Congress to ask the RCN Congress and Council to work on lobbying for a CNIO to be at board level in every single health and social care organisation across England, Scotland, Wales, Northern Ireland. So this is a really important thing that we're doing from an RCN perspective. So how can you be involved in that? Well, you might want to join the forum, and you can do that if you're an RCN member. You can go onto your account and you can make yourself a forum member. There is a newsletter that comes with that, and I think you're going to start to see this forum start to do a lot more. It's been a bit quiet for a while, to be honest, but we're gearing up. The last thing was every nurse was an e-nurse. So this is going to be a really important thing this year. We'd really value your support. If you're going to be there at Congress, do get involved in the debate. Let's make this really count, and let's get the RCN Council to be lobbying for this and working with central organisations so that we make sure that there is diversity and that the nursing voice is heard at that board level.
Wow, thank you, Tim. I'd love to ask a million questions. I'm very excited about both of the first two panelists' comments, but I'm holding myself back, and I'm going to hand over to Jacqueline talking about her role as a nurse in a supplier organisation, and how she would like, I guess, how you would like us to use our collective voice, and how you use your voice for us, Jacqueline.
Yes, Natasha, thank you. Hi, everybody. Nice to see you. As everybody says, virtually, it's quite an odd thing, but I'm really glad to be here speaking with you. And it was just to say that actually, Natasha, I work for System C, not Cerna.
Oh, so, I'm so sorry. It's all right. Cerna, isn't it?
But just getting that out of the way. So yeah, some of what I wanted to talk about today really is the fact that I'm a digital nurse and working for a supplier organisation. And through that, I have the privilege of working with colleagues across organisations across the country, which is a really interesting and varied thing that I can do. And I've also set up a support network for our customer clinicians to be able to meet with each other and talk about things and learn and have workshops. And we recently had your deputy Sarah and Tracy from Health Education England and some colleagues come to our network meeting, which is great because it allows those nurses to feel, and AHPs and midwives to feel heard. But some of the conversations I have with them bring up some issues that they're having because digital is quite a new career option and it's not a common one yet, and there's a lot of organisations who are yet to start the journey of clinical digital functionality. It's not all hospitals have a clinical nurse or a clinical midwife or a clinical AHP, so they're often starting from scratch when they come to looking at the job description. And moving forward, digital is here to stay. Technology is, it's not a passing phase. It will be here to stay with us. And as we move forward down the clinical pathway, there's more and more clinical functionality coming, and it's complex and it needs local clinical input to make it a success. So a digital career is a positive thing for nurses and AHPs and midwives to do. But one of the key issues that we have at provider organisations is sometimes, as I said, it's a new thing. So what does that job look like? What does the job description look like? How many people do we need? What do we need? What banding? What titles? There is no template at the minute, and it is not the same as recruiting a nurse, a midwife, a physio, for example. There is no guidance on numbers. So often, as I say, they're starting from scratch. They're moving into somewhat of an unknown territory with clinical digital functionality, and they're trying to create these jobs in the abstract, which can be really difficult for people to do. I say there's sort of three elements. The title, some people say it's semantics, but we've got lots of titles out there. But when it comes down to the fact that, for example, a clinical digital lead who's an AHP being told they can't, who's doing the job, being told they can't go for the CNIO role because they're not a nurse, it's no longer semantics, that's people's careers. And so we need to be really careful and thoughtful about what we entitle roles moving forward. Again, the banding, is it a 7, is it an 8D, is it a 9, is it something in the middle? How many of them? We need different levels of digital nurses. We need CNIOs, but we also need project level nurses. the problem is if you only have one and you choose one, you could end up with people working outside their job description, and that's what we find. Sometimes we have sort of relatively new band 7s, newly promoted band 7s, having to work up and trying to deal with things like governance and policies and procedures that perhaps are outside their skills and experience. Or you have CNIOs who are getting fed up working down in the nitty-gritty of a project when in fact they can't get to the help with the strategy and the visioning. And as Tim said, you know, looking at board level people, they don't want to be into the detail of individual projects. They need to be thinking at a strategic level. And the other thing I found is that because of people not, the job description not being reflective of the role that they're doing, people get really anxious, particularly maybe a new band 7 or a band 8E, you know, about their appraisal. They're not working to the job description. How is that going to fit in? And if the jobs, which often they are in hospitals as they start out, they're a seconded post and they're hoping to make that substantive, how do they go about showing that they're doing the job that they need to do? And they will be doing what they have to do, it's just not reflective. So I would really advise organisations and individuals to push for a review of job descriptions, maybe 6 to 12 months into a digital clinical programme, to make sure that it is relevant, that it is fit for purpose, that actually it does reflect the job that people need to do, and it's at the right band. And if they need different resources, you know, to make sure that they can try and do that. The other big thing for me is that, or for them, not for me so much, but them, and having done it myself, moving into suppliers, but is moving out of a clinical and very known clinical environment, very comfortable clinical environment where they're responsive to patient needs, etc., and working in IT, which with IT projects or whatever, which is a very different culture, different environment, sometimes have a different language that you've got to learn. So I always encourage and would say to people, if you're not getting the support you need, please, please, please have a ... line to a professional lead, another nurse or midwife or allied health professional, senior person who can support you, and you can go to for clinical supervision. And if there's any clinical issues you're having, you've got somewhere, because your management up through IT may not be able to fulfill that need for support. And clearly, having had Tracy here, who I see is on the call, talking to her network, CPD, postgrad courses, just the fact that Health Education England are looking at the what nurses and other clinicians need to support them to get the skills and experience is really important. You know, we want this to be a valid career choice and a real opportunity for nurses to develop in this new and really exciting times of moving forward with digital. And I think, Natasha, with your becoming established with your team, HEE, as I say, looking at education, the work the RCN are starting to look at, I'm hoping that lots of these issues that we see out in provider organisations can be resolved, and, you know, meaning, that, you know, a digital career is a real positive and exciting one to choose. So that's my key messages for today. Thank you.
Thank you very much, Jacqueline. And I'm mindful of time. We've got 11 minutes left. It really would be nice to get some questions. I know you prompted lots of thoughts there for me. I know it was brilliant. You know, this is one conversation in a whole series we're going to have as a community. So we don't have to do it all today, which is good. I'm going to hand over to Julia to give us the perspective from DMERG.
Hi, so my name's Julie and I am a digital midwife, and one of the roles I also have is the chair for the Digital Midwives Network, which came across to NHSX in July last year, and since then the Digital Midwives Expert Reference Group has now engaged with people like Joe on the CNIO network, so we're starting to branch out into other areas as well, which is helping us build the networks to understand what's out there specifically from a development perspective. One of the big things about the DMERG is about raising the profile of digital maternity and the requirements that are placed upon us by policies and needs of data moving forward from now to where we will be. The data's just grown exponentially, and we need people who are able to manage those system suppliers, particularly holding people to account where they're not achieving where they should be, and having that voice, as Jacqueline said, about having the skills behind the clinicians to work at a different level that's not necessarily on the shop floor. So one of the things that we are doing within this next year is about empowering the digital midwife, and we're making sure that we're aware of what scope is out there for training, for CPD, for cross skills. And also we were really pleased that the Royal College of Midwives recently released their policy statement regarding having a digital midwife in every trust. So that went out yesterday, so we've had a really good response to that. We actually run another group aside from within the DMIRG, because that's an open forum. So we've got quite a lot of members on the WhatsApp group, which we've also got in the CNIO network with Joe. So there's a lot going on for our profession as well. We all need the skills. We're just all in different specialties, and I think that's the big difference. Other than that, we're still trying to do a job that very few people understand.
Julie, thank you very, very much. And thank you to all our panel members for sharing their thoughts. I'm going to kick off with a question from myself before Lauren points out to me any of the key questions in the chat. But I'm curious about Jacqueline, you referred to a multiplicity of roles, I think, really. So yeah. Clearly we need to start at the top of the pyramid with a CNIO role, and I'm really excited that the RCM have launched that policy statement. And I know the RCN will be looking on and noticing that and thinking about their position. But what do you think the ideal, what are the numerous roles, Jacqueline, or the ideal team of nurses in any organisation to lead this?
Yeah, so ideally, I think it depends on the size of the organisation. It is multifactorial, but you certainly need project level staff and clinicians who can work alongside their colleagues and their peers out in clinical practice, who are supporting education and training and testing and all the kind of detail that you need, understanding the functionality and supporting it to go out. That's not the role of the CNIO, who needs to be looking at the digital strategy and supporting the execs to create that vision and see the future digitally. So they're very different roles. So I think you need both levels. So whether it's band 7AA, digital matron, digital lead nurse type roles, and that I mean, when I say it is HP midwife, because I'm really trying to be role agnostic, and certainly my network is about just digital leaders, not siloed, because I think we all need the skills, whatever profession we come from, and we need that going forward. So led by a CNIO type role, I think band 7AA, and then to CNIO leading the team of clinicians, depending on the size of the programme, the size of the organisation, will depend then on the numbers you need.
Wonderful, thank you very much. And there's a lot of questions in the chat about access to training and education. And I wondered what the panel's view on what that should look like, perhaps just for the CNIO role or more broadly. And I'm going to come to Joe in the first instance to ask about that.
I think it's a really difficult one, Natasha, because I don't think we're short of options in terms of the training and education that's available to people, but it's choosing what's actually most relevant for you. And it'll be very different for different people, depending on the type of role and the sort of level that they're going into an organisation at. I have to be honest and say, I think something for me that's actually more important than training and education is actually peer support. So finding a role model or a coach or a mentor or somebody who's working in a a similar role, or somebody in a role that you aspire to in 5 years' time, and finding that person and making a connection with them, I actually think can be in some cases more important than a formally recognised training course. And I do think from that there are some great courses out there, but one of the things that I would say is that be a little bit careful that you don't get pulled down too technical a route. And by that, I don't just mean technical from an IT perspective, I mean technical from a project perspective. If I had £1 for every time somebody suggested that I go on a project manager course, I'd be able to retire early. But that's not what I want to do. And it comes back to what you were just saying, Jacqueline, about what kinds of people you need within any organisation. It's about having the credibility to bring your colleagues along with what you're trying to achieve. And that's not about a training course, and it's not about what band you are. It's about making sure that you've got the right group of people to have the credibility to make good things happen. That sounds a bit twee, doesn't it? But so I think there are lots of training opportunities there, but it can be actually really difficult if you're new in role to sift through those. So what I would very much recommend people who are very new to do is to find somebody who they can talk to about what their options are.
Thanks, that's a really sound answer. And I think what you point to as well is that need for networks, I heard you say. And actually, you know, people listening today, we've had some examples of amazing networks already. So there's a lot to join to try and find that sort of mentorship and sharing relationships. Absolutely. I certainly remember myself joining the Digital Health Network when I felt a bit like, where are people like me and how do I learn? And the Digital Health CNIO Network was a great source of learning, and just coming on events like this is so helpful. Definitely. Isn't it?
Yeah, absolutely.
So it's probably important to consider that really before there's a role for formal training, but before that, it probably is worth considering that. And I wondered what Julie's view was on that, particularly as I know she's recently enrolled in a master's in health informatics, and I'm wondering how that's going for you, Julie, and where you see that fitting with all the other ways you learn and grow as a digital midwife.
So the course itself is going really well. I'm actually enjoying it so much more than I thought it was going to do. The title was a little bit off-putting, I must admit. Healthcare analytics and artificial intelligence. But it's taken, what it's done is it's widened my network scope as well, from not just the CNIO network and the Digital Midwives Network. Now what it's enabled us to do is to go out internationally. We're working on that course with people from America, from South Africa, and Nigeria. So there's all sorts of different networks that are out there that we're now reaching out to, and it's quite interesting seeing the similarities and the differences between processes of working and the way healthcare systems are in other areas. So it's just enriching your knowledge, and if you can get on a wider scoping course, then absolutely go for that, because you'll get so much more out of it rather than just the title. I agree with Joe, there's so much out there that you could go and cherry pick what you actually need, but the value to it is that generally comes from the people you're with on the course.
Yes, absolutely. And I think that's interesting when we think about the Digital Academy, isn't it, where traditionally nurses and midwives and AHPs have all been underrepresented in that academy, and over the 3 cohorts we've seen that grow, and I think I would be encouraging people who are on that trajectory to really start to think about joining something like that, for the benefit they get for themselves, but of course also for the benefit of the whole group that come together to learn together, don't you think? Yeah. And I saw Tracy Whittle, I think it was, or Jackie Whittle had mentioned that would be a good idea. And we are in our last minute, so I am going to stop questions at this point. But it's been a fantastic discussion. I think I'd like to round up by saying, you see, this is what happens when you have a collective of leaders who are working in different places, be it System C or Cernity, or wherever they may be, that I feel really heartened by this session in terms of how we can all support each other to move forward as a community, and how we're going to shape out that sort of strategic way of going forward, because there's a lot of asks from this group about support, and I think it's important that we that people find the way, but if we can signpost them in any way. So all those suggestions and asks about career and, you know, how you move from undergraduate all the way through, are all the sort of things that I think we as a collective are committed to. Would you agree, panel?
Absolutely.
So trust us that we'll be moving that forward, and you guys all move that forward, and let's all stay really connected to use our collective leadership voice and see how we take over the digital world as a collective of professions and really have a loud voice in this space. Thanks everyone for joining us so late in the evening.
Thanks, Natasha.